This video is on diabetes and is presented by San Joaquin Delta College Nursing Program. What is diabetes? Diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. Most of the food we eat is broken down into sugar, also called glucose, and it's released into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin acts like a key to let the blood sugar in your body cells use for energy. If you have diabetes, your body either does not make enough insulin or can't use the insulin it makes as well as it should. When there isn't enough insulin, our cells stop responding to insulin. Too much blood sugar stays in your bloodstream. Over time, that can cause serious health problems such as heart disease, vision loss, and kidney disease. There are different types of diabetes. Type 1 is a condition in which your immune system destroys insulin-making cells in your pancreas. Type 2, the body either doesn't produce enough insulin or it resists the insulin.
For signs and symptoms of diabetes, we have low blood sugar in the body. This is known as hypoglycemia. This is considered levels less than 70 milligrams per deciliter. Symptoms include confusion, dizziness, high blood pressure, headache, irritability, hunger, sweating, high heart rate, and trembling. A person with hypoglycemia may also appear pale. They may feel cold and clammy. We also have high blood sugar in the body, and this is known as hyperglycemia. This is considered levels more than 120 milligrams per deciliter, and symptoms include thirst, headaches, high blood pressure, high heart rate, frequent urination, blurred vision, fruity breath, shortness of breath, nausea, and weakness. We also have diabetic ketoacidosis. This is also known as DKA. This is a condition where the body does not have enough insulin or it does not produce enough insulin, and the liver has to break down fat into ketones for energy. These high levels of ketones are toxic for the body. This is an exacerbation that may occur in type 1 and type 2 diabetes, and early signs and symptoms include extreme thirst, dry mouth, and frequent urination. Late signs and symptoms include fatigue, difficulty breathing, fruity breath, nausea and vomiting, confusion, and fainting.
Okay, so with type 2 diabetes, we do have a couple of risk factors. This slide is going to show your non-modifiable risk factors, or things that you can't necessarily change about yourself. So one of those is your family history. So let's say someone in your family, like your mom or your dad, has type 2 diabetes. You will have an increased chance of developing it in your life. Same goes for your age. So generally those people 45 years or older might have an increased risk of developing type 2 diabetes. Same with your race or your descent. So if you are of African American, Alaskan Native, American Indian, Asian American, if you're Hispanic or Latino, Native Hawaiian, or of Pacific Islander descent, you can also have an increased risk of developing type 2 diabetes. And then on this slide, we have some more risk factors. Some of these you can change about yourself, like being overweight or obese. If you have high blood pressure or hypertension, if you have low HDL cholesterol, which is known as like the good kind of cholesterol, or if you have a high level of triglycerides in your blood, which is also known as like the fat levels in your blood. If you live a sedentary lifestyle and you don't exercise very often, that can also increase your risk. Also, if you have had heart disease or a stroke previously in your life, or if you have had gestational diabetes while you were pregnant, or another one is if you have PCOS, which is also known as polycystic ovarian syndrome, that can actually increase your risk. And then also there's something, if you've noticed areas of darkened skin, usually in your armpits or your neck area, that can usually indicate insulin resistance, which can indicate that you might be at risk for developing type 2 diabetes.
So the main treatment for diabetes is to normalize that insulin activity and blood glucose. This reduces further complications such as that hypo and hyperglycemia. There are 5 components of diabetes management, and nursing management includes a lot of education. The main thing I'll be touching on is monitoring and medication administration for nursing management. But for education, patients need to know they should be exercising 3 times each week with no more than 2 consecutive days without exercise, and perform resistance training twice a week. Exercise is extremely important in diabetes management because it lowers that blood glucose and reduces cardiovascular risks. For nutritional therapy, the patient should know that they should be eating 50 to 60% carbohydrates, 20 to 30% fat, and 10 to 20% protein. And the majority of their carbohydrates should come from whole grains. Further education could include rotating injection sites, the signs and symptoms of hyperglycemia and hypoglycemia, which were mentioned, and resources and support groups. For medication, the main therapy is insulin. There is different types. So we have insulin pens, insulin pumps, and jet injectors. And then we also have oral agents to treat diabetes. For monitoring, we have another slide to take a look at. So monitoring blood glucose, it plays a big factor in nursing management as well as management for the patient. Monitoring that blood glucose allows for the nurse and even the patient to understand how much insulin they should be given. So in the hospital, typically blood sugars could be taken before meals. Those not receiving insulin may get or assess their insulin or their blood glucose levels 2 to 3 times per week.
Now here we are going to take a look at the prevalence of diabetes in San Joaquin County. As you can see in the San Joaquin County 2019 Community Health Needs Assessment, diabetes is one of the highest priorities. And on the chart on the right, we are looking at the percentage of people who are labeled as obese in adults and youth, the diabetes management, and the prevalence. All in all, this shows how San Joaquin County has high rates of people suffering from diabetes compared to California as a whole. Here we are looking at the diabetes mortality trends in San Joaquin County. This is diabetes deaths per 100,000 of the population. As you can see, the number of deaths from 2017 to 2018 are about the same, which is 680 deaths. Also, when you look at the graph, San Joaquin County has more deaths than California overall. Now, here is another look of deaths caused by diabetes according to sex, age, and race, also compared to California and United States. On the top is by sex, where there are more men than women who suffer death from diabetes. Then there is age, where there is a greater number of 85-year-old or older who died with diabetes. And the graph to the right is by race, which shows a greater number in African Americans.
All right, so you either have diabetes or you want to prevent getting diabetes. Here are some excellent resources for the San Joaquin community. Through the Health Plan of San Joaquin, we have a diabetes prevention program, as well as a program for people who currently have diabetes. You will learn everything from meal planning, medication education, eye exams, and much more. Through Dignity Health, we have diabetes classes open all for education through call and Zoom, and meetings are listed on their Diabetes Navigator page. There's also an excellent resource in Unite for Diabetes San Joaquin County, which offers free local classes and programs that provide education and resources on preventing diabetes, managing diabetes, controlling diabetes, and much more. Lastly, there's a Sweet Success Diabetes program, which offers support to women who develop diabetes during pregnancy or have diabetes before becoming pregnant. This program offers information and tools needed to manage blood sugar levels to protect you and your baby during pregnancy. Here are our references. And thank you to SlidesGo for the amazing PowerPoint template. And thank you to all for listening to our presentation.